Our next task is psoriasis. Psoriasis. In this particular case, you're an FY2 in a GP surgeon. You're dealing with a middle-aged or a 36-year-old young woman who has presented with some rashes. The presenting complaint is rash. She has noticed these rashes on the knees and the elbows for the past couple of weeks, 4-6 weeks, for about 6 weeks. The rash is not itchy. Other than having the rash, she is normally fit and well. She has tried some creams from the pharmacy, but the rash has not responded. Approach to the task. We're going to take the history of the rash. When did the rash appear? And where does she have the rash now? Where did the rash appear first? On which part of the body did she develop the rash first? Did the rash spread anywhere else? Can you tell me about the rash? What type of rash it is? Is it reddish? Is it scales? Is it plaques? And has it happened before? Is the rash itchy? Any bleeding? Any pain? Have you tried any treatment so far? What treatment have you tried? So we're going to talk about the history of the rash. Then we're going to continue. Rash is non-specific symptoms. We're going to do a systemic review. The respiratory, we're going to do systemic review. Yeah, respiratory examination, cardiovascular, joint, gastrointestinal, everything we're going to do. Yeah, genitourinary. Yeah. We're going to take the rest of the history. Then the eyes, anything you feel could be the cause. Have you thought of anything that could be the cause of this rash? Then you do the rest of the PMAF dosa. The past medical history, medication, allergies, family history, travel history, occupation, social history, anything else. Examinations, they'll give you a picture and you can see on examination, there are some rashes in here. Yeah, plaques-like, scale-like, but there is no bleeding as of such, and you can see it's on the knees. Diagnosis, explain she has got psoriasis. Psoriasis is a chronic condition which affects the knees and the elbows. It may cause rashes such as redness, scales, or plaques. It is a chronic condition. Management, explain that there is no cure for psoriasis. The treatment is aimed at controlling the symptoms. So unfortunately, there is no cure for psoriasis. Okay, any treatment that we may offer you is aiming at controlling the symptoms. The rash may come and go with time. So advise to use emollient to reduce the rash. So use emollients daily and as much as possible. Prescribe steroids for 1 to 2 weeks. I will prescribe the steroids for 2 weeks. You continue using them daily. It's a steroid cream, okay, to apply. And once the rash has disappeared, you need to stop using the steroids, but you can continue using the emollients. We arrange a follow-up in 4 weeks' time to assess how you have improved. Offer a leaflet about psoriasis.